first came out. So let me ask you, if a colonoscopy does find something, can you be charged for it?
Well, according to the government's interpretation of the ACA, there should not be a cost to you even if they do find a polyp, and it has reiterated that point several times. I mean, as Ms. Melville says, the whole point of screening is to see if there's a potentially problematic growth and snip it out for testing to make sure it doesn't evolve into a cancer.
Exactly. So why is the patient being charged here?
Well, some providers continue to regard it as a kind of gray area, and hey, if the patient doesn't know to protest, the provider gets paid for the charge.
Well, I mean, are there times when you could be legitimately charged after a colonoscopy?
In some cases, if you're having symptoms, your doctor may order a diagnostic colonoscopy. Yeah, you can be charged for that. Or if you're at very high risk, the test can be called diagnostic from the beginning. But it's not okay to change the game in the middle of the test. Like, oops, suddenly you owe $2,000?
Right. So how often do people get bills like Elizabeth did here?
Well, part
Twice,
of the reason
3 times.
we
My
chose to
husband
do
and I.
this one is we do get a number of complaints about colonoscopy charges to bill of the month. The problem is that there are 3 categories of colonoscopy: screening, diagnostic, even treatment. And where your colonoscopy falls can be a bit in the eye of the beholder.
Beholder. And beholder in this case is the one who sends you the bill?
Yes, and if you're thinking revenue, that may not sound very noble, but it doesn't hurt to try and bill. We do know the government hasn't been doing any enforcement of the rule with hospitals or insurers, so, that kind of leaves the door open.
Huh. Okay, well, what eventually happened to our patient, Elizabeth Melville?
Well, as so often happens, after our reporter called, the story changed, and the hospital said, oh, sorry, it was a mistake.
Oh.
So, good news, she doesn't owe the $2,000.
All right, that is a great result for her. So, for everyone who does get a colonoscopy, what should they keep in mind in general? I'm going to think about this in 10 years.
Yeah, I mean, we cannot do a bill of the month for every colonoscopy in America. So screening should be at no cost to patients. So ask the practice before you do the dreaded prep for assurance that the test will be billed as screening, even if a polyp is found and biopsied or removed. Ask to see those consent forms before you've done your clean out, and don't sign one in which you agree to pay for anything your insurance doesn't cover. People between the ages of 45 and 75 who have no symptoms should be able to get their regular recommended screening colonoscopies for free.
Great advice. And to everybody who has a colonoscopy coming up, good luck. Dr. Elizabeth Rosenthal, editor